Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, man, we're really excited to have you here because we're having some incredible conversations with real leaders that are painstakingly reshaping the future of healthcare. We're passionate about a few different areas in this podcast. We're passionate about healthcare innovation, leadership, access, and innovation adoption. If it's your first time tuning in, let me just take a quick step back and give you the details of what we're really trying to get done here. So we're focused on bringing real stories of innovation to life, not just the theory, but people that are actually really getting stuff done and highlighting them, giving them the space to share their story, their wins, their learnings, with our community, and ultimately giving them the platform to share that with the rest of the world. We've got an amazing action-packed year. If you haven't checked out any of the historical interviews that we've done, please, wherever you are, if you're watching this, however you're consuming it, or if you're listening to this, hit the subscribe button now so that any new interviews come directly to you. So every now and again, someone steps into the storm with the clarity to name what's not working, and more importantly, the courage to build what might. Bo Wilkes is that kind of leader. I mean, he's a senior VP and chief growth officer at Ballad Health and the president of Ballad Ventures. And for nearly 15 plus years, he's worked across the full arc of the healthcare system, from strategy to operations to governance. And I think what sets Bo apart isn't just the depth of that experience, it's actually how he's using it. So Bo he's a healthcare strategist with a bright entrepreneurial spirit that's leading Ballad's transformation efforts on two fronts. First, through the Ballad Health Innovation Center, which is a team of thinkers, project managers, and builders that are focused on reshaping care across 21 hospital role system in Northeast Tennessee and Southwest Virginia. And secondly, through Ballad Ventures, the organization's capital arm, focused on investing in the kind of disruptive ideas that can actually really move the needle on a few different fronts, on costs, on access, and on outcomes. So he's sat in every seat. He's led operations at key hospitals. He's helped shape sort of system-wide planning, and even stepped into the founder's seat as an interim CEO of a pelvic floor therapy startup. So whether he's working inside of a hospital or with a venture capital firm like LRV Health, Bo brings sort of the same level of consistency, the same posture. He's practical, adaptable, and always pushing for alignment between mission and margin. So this conversation today for me isn't just about models or markets. It's really about mindset. It's about how healthcare leaders like Bo are navigating constraint, without really losing sight of the opportunity to build something better. So, Bo, it's great to see you. Welcome to the show.
Michael, thank you for the warm introduction. I think I need to get you to do my intro pitches for me more often. It's fantastic to be here. Engaging with you over the last 6 to 9 to 12 months even
Yeah,
has been fantastic. It's really been insightful. So I agree, everyone. Michael has some phenomenal guests and content, so I encourage everyone to engage and really interact, whether it be podcast, LinkedIn, whatever it may be. He's fantastic.
appreciate that, man. Thank you so much for that. You've been sitting with the uncomfortable truth that many of the old levers, no longer move the needle, and that's kind of what sparked this conversation. And you've had to face the reality that not just in the boardroom, but across the 21 hospitals spread across rural Appalachia. You mentioned in kind of a back and forth that you were staying up late one night, watching the Senate floor, trying to track where this, one big beautiful bill was going to land. It's landed. I'm just sort of curious as you were going through that, and you like to think ahead. What was going through your mind that night, and how does that tie into sort of the pressures that healthcare leaders like you are sitting with right now?
I think the one big beautiful bill becomes the tipping point, right? As we think about where that's going. I don't necessarily think it started. I don't think it's going to end there. As you think about the future, maybe this is the catalyst to really start thinking
Yeah,
about transformational change and engaging. But you know, for the longest time, health systems have been built on hospital margins, and we're now having the conversation that, maybe hospital margins are what's going to sustain healthcare moving forward. So I think as
Yeah.
you think about, rising cost, in rural America, kind of slowing inpatient volume
Hmm.
and, challenging payer mixes, we're going to have to think differently about kind of what the future is for health systems, for access, and ultimately, quality of care.
Mm. Thinking about all the different tours of duty that you've done, looking back, I mean, it's been what you said, 15 years of, inside of this system. However, in very different roles. How has, I guess, that long view changed about how you see growth, risk, and actually like what's even truly possible?
I think that's an interesting question. I have an immense amount of respect for hospital CEOs. I mean, they have a very, very difficult job, in today's world in operating. I had a boss very early on that said, the challenge of executives is trying to see kind of what's around the corner and what's coming
Yeah.
next. And, continually positioning ourselves for now what we're considering revenue diversification. So again, moving beyond the hospital walls, you're starting to
Mhm.
see care move into more of the ambulatory setting. You're seeing,
Right.
folks like reimagine care that are trying to provide infusion therapy in the home, which I
Hmm.
think we all would love to, if we are sick to, find a cure or, seek treatment for our ailments in our own, the comfort of our own home, whether it be on the couch or the bed or wherever it may be, as opposed to in a hospital. And so I think this progression of care is important, and we need to understand, the quality implications and the experience of it, but also what is the cost of all of this as we move forward. And so looking back over my career, thinking about strategy and ops and just a
Hmm.
number of different elements, I think that's the part that, I try to weave all the way through, understanding the cost structure, understanding the quality implications, and understanding the experience of not only the patient, but
Hmm.
also the caregiver. That also becomes very important.
Yeah, there are certain things that that aren't going to be changing anytime soon, right? There's not going to be a patient who's going to want to show up and say, "Hey, I want to be treated poorly today." They're always going to want to be treated nicely. And clinicians that, for the most part, they want to work atop of license, and they want to work in an environment where they feel valued and where they feel trusted and where they feel like they can grow. And I believe it was Jeff Bezos that said, innovate in the areas that aren't going to be changing anytime soon. And I'm not smart enough to think of anything new in that respect, so I'm kind of following that vein. Where do you see innovation in those areas that aren't going to be changing anytime soon, despite all the noise that's going on in Washington and all those things? Where do you and your team kind of place your focus to say, here's what we're going to innovate in, because this isn't going to be changing anytime soon.
I think you start with access. Access is constantly changing, right?
Yeah.
And the transformation of that. I mean, you would have asked me 2 years ago whether telesurgery was, an opportunity, truly having a physician, whether it be in New York operating on me in Johnson City, Tennessee, or, vice versa even. And so, starting to see kind of transformational plays of where we can provide better access, especially to our communities
Hmm.
within rural America, really starts to open the game. And so that's one area that we can start to think about. But there's so many other different access points. There's things like OnMed as an example, which is
Hmm.
basically a 10 by 20 box that you can basically deploy anywhere, that's got peripherals that drop in, allows you to connect virtually. Access becomes such a critical point of where I think healthcare needs to evolve to, and evolve beyond just, as we think about traditional, whether it be a clinic-based setting or even a
Hmm.
hospital-based setting, how do we really expand the walls and expand the access of that? And then you go all the way to digital care, right? The asynchronous and synchronous level of care that we need and get, especially as folks struggle to have primary care doctors, um,
Mm.
becomes a huge element that I think could play nicely throughout. And so for us at Ballad, as we think about rural healthcare, access becomes just a pivotal part to where we want to
Yeah.
place our bets and think about what's next.
Just sort of thinking along those lines, you mentioned, look, for years, the industry's really looked to optimization, process redesign, AI as sort of these answers to this, financial strain. And I'm thinking it's like, well, what happens when the toothpaste is out of the tube and there's nothing left to squeeze? I mean, you've said before that optimization is a bridge, not the destination. Was there a moment where, you know, even just when Ballot did everything right, operationally did everything right, and yet maybe it still didn't change the financial reality?
I mean, I think that's kind of going on. You look across the industry, whether it be right sizing corporate structures, trying to automate and optimize where you can. Optimization and kind of automation, it buys you time, but it's not going to buy you sustainability.
Mm,
And so as you really begin to think about that, that's where our work started, right? We spent a tremendous amount of time in kind of the leaning of processes. So thinking
yeah.
about what we call operational excellence, how do we continue to push waste out of the system?
Hmm.
Now what we're evolving that kind of lean methodology to is how do you get to that optimization? So how do you begin to layer in technology thoughtfully, not
Yeah.
adding technology to where folks are spending more time in front of a
Yeah.
computer, but the intent becomes how do we actually increase more human interaction
Mm,
by layering in the technology. And so I think that becomes huge. We've got a chief clinical officer and a number of physicians around him that are really focused in on this effort. And it's, the logical adoption of technology and what is that base ultimately going to solve for us? How do we reduce the administrative burden that's placed on so many of us to make sure that,
yeah.
we get clinical documentation right so that, we can ultimately get reimbursed in the appropriate manner? How do we optimize that utilizing technology to allow for more of a conversation between a patient and a caregiver? Because that's where treatment and cures really start to happen is when there's true human to human dialogue. That's never, in my opinion, never going to be replaced.
Yeah, that's where the magic happens.
Right.
I'm just thinking when, as you mentioned about this diverse team that you have that have all these different areas that they focus in on, how does that team decide which tack to go or which process to change? Can you kind of maybe take me into the war room for a minute, behind closed doors? You obviously don't want you to reveal anything that's you're not able to reveal, but what are those discussions like? How do you decide which thing to move forward with? What's priority? What's not? Maybe take us through any example that you're able to share would be great.
Yeah. So everything is rooted in our strategic plan, right? As we think about venture capital, as we think about innovation, project management, operational excellence, all those different elements, everything is rooted in the priorities of our strategic plan. Like technology, we don't want to add one more thing to what it is we're doing, right? We want to
Yeah.
make sure that what we're doing is supporting the overall mission and strategy of the organization. And so spend a lot of time with our chief strategy officer as,
Mm,
what we call our management action plan, which is our strategic plan, as it's
hmm.
being developed to really then engage with our key stakeholders to make sure that, priorities are placed. We've got North Star goals that set our direction. So as we think about financial metrics, as we think about quality metrics, experience metrics, all those become the driving force
All right.
behind where our innovative efforts come, behind where our venture capital bets, are ultimately placed, because
Mm,
we want to have that strategic engagement. As I think about
mm,
Ballad Ventures in particular, we don't want to make an investment in an area that we don't bring a lot of expertise in. We really
right.
want to, make an investment. We want to lean in heavily and
Hmm.
really think about how it not only solves challenges for us operationally and
Right.
strategically, and then ultimately, hopefully long term produces a financial return for us.
Mm. There's often things when we talk about innovation and wins, you're not winning all the time. If you could maybe remove one, just call it baked in friction point, from the traditional healthcare system, something that you know, quietly chips away at progress. What would you pull out first?
The negative connotation of failure.
Mhm.
As you think about innovation and trying, I think the term pilots are often overused in a lot of
Yeah,
industry, not just healthcare, but failure comes at a cost, obviously, but there's a lot of value that can also come from that.
hmm,
As we think about innovative efforts, trying to do kind of a postmortem on the back end to understand, what went well, what didn't. We don't want to replicate those mistakes over time, but if we're trying new things and we're pushing boundaries, there's
hmm,
going to be times where we have to pivot, midstream. I
yeah,
don't know of a single startup that, from the moment they started and said, "Hey, I'm going to do this and this is how I'm going to get there," that
yeah,
they ultimately went on a straight line, right? It's messy, it's, curves back and forth. And so this idea of failure we talk about often, fail fast, and ultimately begin to move this thing forward because what it ultimately begins to teach us is it begins to change a culture. And we started to see that in Ballad where folks are willing to step out on their own, try new innovative ideas. But then it also begins for folks to really think outside the box, to think about what's next
yeah,
and ultimately begin to push those boundaries. So I can't stress it. This idea of failure is you can't fail all the time, right? And you can't repeatedly fail on the same mistakes. But pushing boundaries and testing things are going to challenge you. And so,
yeah.
you need to not worry about that. You need to push for that. And if you fail, fail fast and then let's learn from that and move on. So I think failure is from a traditional mindset in healthcare becomes a challenge.
Yeah, replace the word failure with learning. What are you learning? And I believe it's a really great book that I studied. Dr. Amy Edmondson, Harvard professor, literally is studying failure. And she was sort of mentioning, like, is it a single, the root, what is the root cause? Is it a single, like, human action, or is it multiple things that failed that could lead to sort of, catastrophic failure? Or is it something that you're learning in a specific safe environment that you can take and then learn from and iterate from? I'm just curious because you're not using innovation as a buzzword anymore. Like you have literally built and embedded this into a culture. How long has it been? Like how long did it take for it to sort of shift from, hey guys, we're really, we are innovative. Like give me the time because I think oftentimes people are trying things and they don't actually spend enough time. Like there's not enough consistency over a long stretch of time. They start something and then they sort of pull back on it. How long were you guys committed to incorporating innovation, to making sure that it was a mainstay within the culture? Like give me an idea of how long that duration was.
It's a journey, and it's an ongoing journey. I won't say we've got elements of where we've really started to see the culture change. We still have opportunities in other areas where we can still make strides and momentum as we move forward. We started small. We've always been very efficient with how we think about innovation. We
Yeah,
want to make sure that it's not this overcommitment of tens of millions of dollars from an operating budget perspective that starts to distract again from the mission of ultimately what we're trying to do. So we still have a very small team that really kind of focuses in on those tests of change. I would say we're on Innovation 3.0. So we started on
right.
Innovation 1.0, where it was a lot of trials and tribulations, right? Where
Okay.
are we finding success? Looking at other healthcare systems. Now, with that being said, as I talk to my peers, if you've seen one innovation structure, you've seen one innovation structure, right?
That's right.
They're
That's
all
right.
different. As we moved to kind of innovation 2.0, it was what's the low-hanging fruit? Where are there opportunities? And so it was a much more of a reactive element of innovation. We
Mm,
started to get some success, whether it be piloting and scaling medical devices, thinking about digital technologies, really began to build our muscle memory as far as how do we not only work with quality and patient experience, but also finance to make sure that we kind of have a model by which we can pilot things quickly, get to a decisions point, and then either scale or
right.
redirect or pull back. That's a very reactive still response to where
Hmm.
there's opportunities. Now we're moving into what I call innovation 3.0. And so it's really looking at the opportunity, the strategy of the
Right.
organization, understanding, from our key executive leadership where our priorities are, beginning to market map out some of those sectors, and then proactively going out,
Mm,
setting up those partnerships and relationships, aligning with our business owners, and then trying to execute on, whether it be, again, pilots or small test of change, ultimately to push that innovation forward. And it's still a journey and it's still going to take time.
yeah.
But it's something that we're constantly working on and working through and trying to evolve.
Mm. You mentioned the key word there, which is aligning. Aligning takes work. Disorganizing and getting people rowing in the same direction. It's the unsexy part of the job, but man, foundationally, it's just so important. You don't have that level of alignment, like you said, across your operational leaders. You're dead in the water. I want to switch gears briefly because I mean you've shared how life flow, from a 410 medical became like a real life-saving innovation in the region. What's the backstory there?
Great, great backstory. And I think it's how all the pieces come together. So, was actually initially brought in by operations within Niswonger Children's Hospital as
Hmm.
something to understand how we could rapidly perfuse fluids into our pediatric population. We actually then became aware of it through our venture lens when one of
Hmm.
the early investors reached out and said, "Hey, do you guys know that and this was through Ballad Ventures, do you guys know
Hmm.
that you're using LifeFlow within one of your facilities?"
Hmm.
So we started to reach out, and it was in the early days of Ballad Ventures. And when we actually connected with the CMO and CNO, they thought it was spam. Coming Ballad Venture, we don't have a venture capital subsidiary, right? This is in the early days of venture, and so after some kind of back channeling, we were able to connect with them, and ultimately it began quickly. So we love the product, what the impacts were operationally. I think within the
Yeah,
first like 2 days, it saved a patient's life that came in
incredible,
septic, and we were able to
amazing.
really stabilize. Um, at the very least, that individual didn't end up in the ICU.
Hmm.
Um, we invested in the company, and then we started to look at what were the implications across the organization. So our two regional CNOs, both we're split between a southern region and a northern region, got
Right.
engaged, became the business owners. We started to pilot in our ERs first,
Hmm.
and then ultimately scaled out into our ICUs, into OB, and now we
Right.
just went to surgery. So we are enterprise wide with LifeFlow. And all of that are really originated with ops bringing
Right.
a new technology in, but then ventures and innovation got involved. We invested, so as the company continues to scale, we're scaling with them across the enterprise. And it's at the end of the day, the greatest thing about all of this is it's saving lives. It's having
Yeah.
real impacts to what we're doing. And so great, it's great from a financial perspective, but if you're the patient or a family member of a patient where lives are saved, like that's where the rubber meets the road,
Yeah.
that's where things really begin to matter.
Yeah. When I think about innovation as revenue, right? That's a great headline. And that story depicts like what it can look like on the ground.
Right.
That's fantastic. On the flip side, like what's an idea that you and the team, had to walk away from, even though maybe it maybe it held promise, but because it didn't really align with the mission or just wasn't like practical.
It, sometimes it's competing priorities, really. I mean, it's where there's opportunity. Most of the time, it's in the digital realm. Very early stage companies with a vision, but as we think about, our commitments elsewhere with our EHR, with our ERP, with just, a number of different things there, really kind of leaning in there. So I think back to the early days of some of the larger
Mm,
AI companies now that are in existence. We had some really
yeah,
good early conversations with them. I got excited, and I try not to be easily excitable because I feel
right,
like there's
right.
just so much tech and everything out there.
Yeah,
But what ultimately ended up happening, we walked away early on kind of the investment and the innovation pilot side because there were competing priorities. IT couldn't ultimately support it, or we weren't ready for it. From an operational perspective, the
right,
maturity wasn't
right.
there. And so we ultimately had to step away. Now, the good thing is I'm happy to report that the organization where we stand and how we've kind of matured, we're re-engaging. I wish we would have done it, 2 years ago, but
Yeah,
sometimes it's timing, right? And timing is everything as well. And so it's that is also, I'll say, is has been a key lesson. You've got to really make sure that you're ready for the innovation at the time. And if you push it, there's a chance you can do everything right and still not be successful if the organization is not ready for that change.
that's right. And as we mentioned before, we hit the record here. We said, you don't grow with your yeses, you grow with your nos.
Right. That's right.
Um, there's so much talk and clamor around, revenue diversification. But when you're leading like in a rural market with tight capital and legacy systems, it's more like you're building a plane in mid-flight. When health systems talk about diversification, to me, I mean, it sounds like oftentimes like it's like a slide from a strategy deck. What does that actually look like and feel like, from where you sit?
That conversation is evolving rapidly. You go back to the one big beautiful bill. I think that's going to have a greater impact to hospital margin. So what is kind of the North Star for organizations as you think about hospital margin, and then beginning to think outside of that? How do you begin to diversify revenue streams? You're seeing a lot of organizations and health systems do that to make sure that they can continue to support the mission of ultimately what we are as not-for-profit healthcare
Mm,
systems.
hmm.
Um, and so I think it's a variety of things. You've got elements of folks that are adopting ambulatory strategies, but to me, ambulatory strategies are successful in growing markets with good commercial, kind of payer mix elements there, which I think is a good strategy. Again, it's moving it outside the hospital from a cost of
Mm,
care perspective. That's not necessarily applicable in a rural healthcare market where,
yeah.
populations are declining, payer mixes are challenging, so have elements you don't necessarily need to build the infrastructure, continue to build the infrastructure. You actually need to make what you have more efficient. Um,
Are there
partnership
any other reasons outside of those constraints that you mentioned on why it doesn't translate so easily into rural America?
Well, I mean, to unpack that, it gets obviously extremely challenging. So
Yeah,
again, population decline, industry, and again, as you think about commercial mix, industry is such a big element.
yeah,
Hospitals become, there's this catch-22 as well. Hospitals become economic engines and almost economic lifelines for rural America. And so when a
yeah.
hospital leaves a community, industry is not quick to follow, right? But hospitals need industry, ultimately, kind of the population, the payer mix, all of those elements to be able to kind of survive and sustain. So if a hospital pulls out, industry is not going to come back in, but also it's hard to continually recruit industry into some of these rural aspects of America because everybody's trying to do it. And so there's
Mm.
the element there. And so it plays through the payer mix. Socioeconomics becomes another big one. I think back to my public health background. What are, as you think about the barriers to change, we
Yeah.
focus in on third grade reading as a great example within Appalachia, making sure that every third grader is able to read at a third grade level by the time they hit that, because that's a huge predictor
Mm. Hmm.
of future socioeconomics, health, success, professional, all those different
That's
elements. And
right.
so it's really beginning to lean into those elements to make sure that, we can ultimately continue to survive, provide access, and provide care across, our service area, but, it applies throughout, the United States.
Fascinating how you pinpointed that as a lead measure that then produces something down the line. That's amazing to see that and just even the
The
trickle
the
down effect.
challenge becomes is, you look at you and I, our behaviors are pretty set, right? Like us
That's right.
changing our
That's
true
right.
behavior, we've really got to look within. If we believe that we can continue to lean into that health education for adults, but to truly make a lasting impact, it begins with generational change. And
Hmm.
so we
Hmm.
invest heavily with our partners. There's the Niswonger Foundation that also helps the state of Tennessee, the Commonwealth of Virginia. Both are actively involved with us as well. And so it's
Hmm.
really beginning to pour into those so that we can continue to develop for our future within our region, ultimately kind of what that health behavior looks like. I mean, there's a number of systems out there doing it. Nemours is focused in on kind of
Hmm.
the one child health. There's
That's right.
there's so many different elements as you think about leaning in to think about that. And so while we want to provide access and quality care now, we also want to focus in on what's the future generation and make sure that we're setting and building a strong foundation for them.
Mm. Yeah, I want to sort of shift gears because we're talking about innovation, I think sometimes that may lend itself into thinking about risk. I want to talk about specifically strategic risk and maybe injecting risk into an organization. Sometimes there's organizations that have a greater level of appetite for it, but going back to what you said, shifting the frame of moving away from failure to learning, because I think sometimes strategic risk, it can kind of live in a gray area between, vision and execution. Where have you seen sort of this tension flare up? How did your team move through it?
I think it's ongoing, as you look at, ultimate drivers of revenue for healthcare systems. All you have to do is look at where venture capital dollars are going, and they're trying to disrupt where, that revenue is ultimately going. So you get back to the strategic risk. On one hand, you have your day-to-day operators and your financial folks that sit and say, we can't afford right now to disrupt our current revenue streams, just given all the constraints that we're
Yeah,
currently facing. On the other hand, as you think about kind of what is the future, you know that you're going to have to adapt. And so at
yeah,
what point do you kind of pull that lever back and forth? That's where the conversations in the boardroom get really exciting, right? Because there's so many intelligent people sitting around the room having conversations, from the day-to-day executive leadership to engaged board members, whether it be community
yeah,
or healthcare expertise that you brought in from the outside. Those strategic levers become huge. And I would stress that, that's where the boardroom conversation needs to be. Alan Levine, our CEO, has done a tremendous job, in making sure that it's a dialogue with the board and, with management, to make sure that we're constantly thinking
yeah.
about what is the strategy, what are the risks associated with such, and how do we balance as we begin to transform without necessarily, ultimately depleting what we currently have to sustain to make sure that we're moving forward.
Yeah, because the truth is there are other folks that have left markets and you guys haven't done that. And that was sort of it seems as though like a very purposeful, intentional decision. Talk to me through that thinking and where are you very bullish um, and excited for remaining within those markets? And where do you see sort of innovation happening within those markets, despite others thinking that, hey, there's really not opportunity here and we're going to kind of pull out?
So, it comes back to mission, right? We want to be rooted in what we're ultimately trying to achieve, to provide superior care to our service area. And so we are very committed to those
Hmm.
communities. Now, the definition of a hospital, I think, is going to continue to evolve. What does access look like?
Hmm.
To a lot of people, it's, hey, digital care is here. Uh, why do you
Hmm.
need so many clinics and hospitals? Well, that's a great idea, but all of rural America doesn't have broadband. Like we have elements where,
Yeah.
we don't have access there. And so, sure, digital might work, but
Yeah.
if you can't access it. And so you got to get really creative in the touch points. And we've tried a number of different things. I think we as an industry, not just at Ballad,
Hmm.
we've
Hmm.
monitored a lot of those different elements. And so it's really beginning to think about what is the future of access points and making sure that we're preserving
Mm.
those access points because access is, a good indicator of ultimately care and health of a region. And so thinking about those things, again, circling back to the point I made earlier and have for a while, hospitals are economic engines viability for
Yeah.
rural America. Without them, they're typically one of, if not the largest employer, and
That's
they're
right.
also huge on whether or not recruitment of other industry into the area is going to occur. And so it's beginning to kind of balance what is the digital elements with the traditional bricks and mortar, the access points that you need. How do you begin to layer those things on? But again, we got to make sure that technology doesn't become an inhibitor, that it actually
Yeah.
improves and streamlines ultimately how care is provided, not spending more time in front of the computer. We want to spend more time in front of the
Yeah.
patient.
I mean, just on that point, as you mentioned around sort of the economic infrastructure, if health systems are going to function as this economic engine, this economic infrastructure, and not just providers of care, because it seems as though that your definition of a hospital has evolved. What has to shift, in how we define value?
I mean, I think it's on all different aspects of the continuum. I think that starting, at the hospital, we've got to redefine what a hospital is. I think then moving to the payer, we've got to think about what are the reimbursement aspects of it that need to evolve with that. I don't necessarily have an answer to that element of it.
Hmm. Hmm.
But you can think about value-based care models, clinically integrated networks. There's a number of different opportunities there. But then the consumer also has to change. I mean, there are hospitals in our region that folks want the hospital to maintain, to preserve that hospital,
Hmm.
but yet they drive 15 minutes down the road to go to another hospital because it's, tertiary quaternary center and it's not a, primary care aspect of things. And so
Yeah.
it's beginning to understand the right care at the right place and
Right.
how we begin to kind of weave all those elements together.
Mm. Well, a couple thoughts. One is, how do people follow your work, the work that the Ballad team is doing? Maybe you can just kind of give them a bit of a commercial so that they can stay tuned with the things that you and the team are doing, how you're rolling them out. What's the best way for them to follow your progress?
Um, Social media, actively involved in LinkedIn, love to get involved in conversation. There's so many great venues, so always happy to reach out and connect. As well as Ballad Ventures, Ballad Health Innovation Center, both have dedicated sites on LinkedIn as well. As we hit big milestones, we try to release press releases, whether it be through all the print publications that are in the
Hmm.
market, but I'm challenging our team as we move into this year to really evolve what we have from a collegial respect. So really engaging
Yeah.
across lines to share ideas because that's where the magic happens, right? It's these conversations. If I didn't state it early on, I don't have the answers, right? But
Yeah.
conversations to challenge every idea, to try new things, to Adam Grant's got a great book around Think Again, right? Like even the basic processes
Hmm.
of what
Hmm.
we know, we need to challenge those to continue to evolve where we are. I think the one big beautiful bill, while it presents some challenges, it's also a great opportunity for everyone. I know from a ballot perspective, like what I'm excited about is we're all rolling up our sleeves and we're getting involved from finance, from strategy to
Yeah.
innovation, like everybody ops, everybody is getting involved. And so that's where the magic starts to happen. So it's really engaging across lines, across systems, across industry even to really kind of push those things forward.
All right. So let's just say I wouldn't even say a young leader. Let's just say a leader is listening to this right now and they're trying to lead through margin, pressure, ambiguity. What's the one thing you'd want them to carry with them and take action on after hearing this?
It's hard and understand that there will be challenges. Don't try to stay as level as possible. Don't get too high,
Mhm.
don't get too low, but understand that there's a guy I follow on social media named Ryan Leake, and he said, you're difficult is the path you choose. He said, you can wake up every day and
Right.
choose to work out because that's hard, or you can be out of shape and be exhausted just all the time. And so difficult exists in life. And
Mm.
so really lean into that difficult. Find that opportunity. Don't get too low with the challenges. Don't get too high with the success. Really kind of ultimately kind of ride through that. And then lastly, I would say is find a mentor. Really find someone that you can connect with, that you can learn from, because mentor-mentee relationship is a two-way street. There are times where I've been the
Right.
mentee and it's flipped to be the mentor. Oftentimes I, try to take and learn and apply as much as I absolutely can. But there's tremendous opportunity out there, and I would say I lead with this. There's kind of three phases to life. You learn, you earn, and then you return.
Hmm.
So early in your career, learn as much as you can. As the middle part of your career and you start to be successful, you start to earn, be sure that you're kind of giving back in those elements, but then
That's right.
make sure that you're ultimately returning all of that the system ultimately provided back to you. So if I can ever be of help, please reach out and engage. Would love the
Yeah.
opportunity. I'm sure Michael would do the same.
Yeah. Yeah. So I mean, listen, you mentioned about not having all the answers, and the truth is that this conversation was never about answers. It was about really naming the real questions and honoring the tension that leaders live in every single day. So if today's conversation, you're listening to this, and today's conversation moved you or challenged you or even made you think differently, then share the episode, share it with a friend, share it with your network. And if there's a topic that you want us to explore or a leader that you like to hear from, drop me a note, leave a comment. I do read those comments. Yeah, this is a platform that's about community, not just content. So thanks for listening. Keep building with purpose, and we'll see you the next time around on the Advancing Healthcare Innovation Show. Thanks for coming on today, Bo.
Thank you.